Hi, and welcome to this important sepsis update regarding the new Sepsis Alert tool. Baptist Healthcare will be going live with a newly developed inpatient alert tool within Allscripts designed to aid in early identification, evaluation, and management of sepsis. This is a best practice tool and is being implemented from an action plan related to a root cause analysis. Early identification and timely management of sepsis is key to reducing mortality. Patients with 2 or more SIRS symptoms in the setting of an infection or suspected infection with signs of organ dysfunction meet criteria for sepsis workup. The SIRS Sepsis Alert tool is designed to activate when the following criteria is met: 1 SIRS symptom and an abnormal white count. This means that if there's a documented heart rate greater than 90, respiratory rate greater than 20, temperature greater than 100.4 or less than 96.8, the system will then look to the last white blood cell count value. If the white blood cell value is greater than 12,000 or less than 4,000, the SIRS Sepsis Alert will be triggered and require action. If you are a patient care tech documenting vital signs when this alert populates, your next steps are to notify the RN and acknowledge the alert by choosing RN Notified. The alert will populate again for the RN the next time the patient is chosen from their patient list. If you're an RN documenting vital signs or choosing a patient from your patient list when this alert populates, your next step is to notify the primary provider team. The RN is to acknowledge the alert by choosing one of the following options: provider to be notified that patient meets SIRS sepsis criteria, in which you would request the sepsis bundle be initiated, if appropriate. Sepsis bundle in progress, which means there's been a sepsis lactate ordered and drawn, blood cultures have been drawn, and broad spectrum antibiotics have been started. Or the last option, which is provider notified of the alert, but sepsis was or has been ruled out. If provider to be notified that patient meets SIRS and Sepsis Alert criteria, request the sepsis bundle. Please ensure that a stat sepsis lactate, blood cultures, and broad spectrum antibiotics are ordered. Antibiotics are to be started after blood cultures are drawn, and it is best practice to initiate antibiotics within the first hour of sepsis recognition or sepsis suspicion. If sepsis bundle is in progress or sepsis has been ruled out, the alert will be snoozed for 72 hours. After 72 hours, if the patient meets the criteria again, meaning 1 SIRS symptom plus an abnormal white blood cell count, the alert will activate yet again to ensure reevaluation. If you are a provider receiving a call or a secured message about a patient who meets SIRS Sepsis Alert criteria, please understand that the logic of this tool does not take into account organ dysfunction. Organ dysfunction accompanies severe sepsis and can be assessed with any of the values listed below. All inpatients should be screened daily for sepsis. Sepsis screening tools can be found in each inpatient unit for guidance. Sepsis can be present on admission or develop at any time during their hospital stay. The SIRS Sepsis Alert tool is essential in identifying potential sepsis and hopefully preventing long-term organ dysfunction and/or death. If the sepsis bundle is implemented, please complete the sepsis bundle completion form, which is printed on the other side of the screening tool. This is used as a checklist, a timeline, and a handoff tool to ensure your patient has the very best outcome. For questions or feedback regarding the SIRS Sepsis Alert tool, please contact Nova Francis, Clinical Intervention APRN. I can also be found on Telmedic. Thank you.